Simply put, our healthcare system has lost its way. We have incredibly expensive and unaffordable care. We are not delivering on the promise of health our families deserve, and we are creating terrible financial insecurity and debt for families across the nation. And believe it or not, 250,000 people a year in this country die, not from their illness, but from the medical system itself. In the most recent decade, hospitals have increased their prices 4 times faster than our paychecks. Part of the effort is also thinking about how do we redesign the economic incentives in healthcare so that a patient goes to a doctor and the doctor is getting paid to do the best thing possible for that patient. And a lot of the new approaches of trying to change the payment incentives, new global payments, risk-based payments, that's about saying, let the doctor, let her do what she's learned to do, and don't put economic incentives in front of her that are in direct conflict with the patient's interests and the interests of the country. Inflation Reduction Act also did something very important. It finally allowed the federal government to negotiate a fair price from drug companies, and then it used those savings to do things like cap the amount of money that a senior would have to pay for their drugs in Medicare. So it reinvested the savings to make healthcare more affordable. That's the kind of reforms we need. No family in this country should go bankrupt if their kid needs care, if they need care. So the first thing we have to do is make sure that people have access to healthcare and financial security to do it. So if you've got 20% of the folks in your community who don't have access to health insurance, we got to solve that problem first. That's the first thing we have to do. The second piece is that we have to understand that underneath all of this complexity, the financial incentives that healthcare corporations are responding to are not aligned with the families and the patients that they treat.